Welcome to this final discussion over the nervous system. Today we'll be taking a look at the autonomic nervous system, and we'll be covering sections 15.1 and just a small bit of 15.2 in the Blossom. We will not be discussing anything in 15.3 and 15.4 and be listening and watching for large sections of these first two sections that will be completely deleted or omitted from your learning. So today's discussion is the autonomic nervous system. This was introduced way back at the very beginning in chapter 12 when you were introduced to the nervous system. The autonomic nervous system is that component of our nervous system which works largely automatically. Right? It is all of the unconscious control of our body. Many of your organ systems are reporting to your central nervous system, but those signals are not going all the way to your cerebrum. They're not going all the way to your consciousness. Instead, parts of your brain stem and parts of your diencephalon, think thalamus, hypothalamus, are dealing with and controlling all of these body functions without basically making you aware of it, without bringing it all the way up to your cerebrum. And you have experienced the autonomic nervous system, but probably this, what I'm going to describe to you, is not new, but probably using different words than what you have used in the past. So as we start looking down at the autonomic nervous system, what we're going to be primarily focusing on for this semester and for this exam is differentiating, compare and contrasting the differences and the structures between the sympathetic and the parasympathetic divisions of the autonomic nervous system, or the ANS. Again, this is going to be the primary role. This is what we're going to be focusing on. We will not be focusing on many other features of this division. You have probably heard of the fight or flight response. The fight or flight response is also called the sympathetic division of the autonomic nervous system. And we've all experienced this. The fight or flight responses are those things that our body does when we're scared, when we're threatened, when we are, fearful of something. Those are those fight or flight responses. And we all know what happens, right? Tell me, what happens to your heart rate when you're scared? We know the heart rate goes up. Not only does the heart rate go up, but your heart will actually beat harder. It will actually beat with greater force. So if you're really, really scared, not only is your heart beat faster, but it almost feels like your heart's going to jump out of your chest because it is in fact also beating harder. What else happens? When you're scared, your breathing rate goes up, right? Your respiration rate goes up. When you are scared, your pupils of your eyes get big, right? The pupils dilate, they get bigger because you want to have greater awareness of your environment. So the pupils get larger so you can see things better. The hair on your skin stands up, right? You get sort of a goosebump sort of look, right? As you are scared, your erectile pili muscles erect and all of your hairs stand on end. Depending upon your complexion, you become more pale, right? I become more pale when I'm scared. The blood flow toward the surface of my skin constricts, goes away, goes deeper. The blood leaves the surface of my skin, leaving me more pale, like white as a ghost, right? White as a sheet. And that blood is now displaced to internal organs, specifically the muscles, right? When you are in a fight or flight response, you are preparing your body to run or to provide energy for it to fight. And so we've all experienced this fight or flight response. Again, that is the sympathetic side of this. And you might think of it as an adrenaline rush. Or you get excited about something, you get this adrenaline rush, your heart rate goes up, your breathing goes up. Everything I just described to you also happens when you have, quote, an adrenaline rush. Now, the other side of this is the parasympathetic. And the parasympathetic nervous system is also called the rest and digest. This is the component of your autonomic nervous system, the division, that is more active when you're relaxed, more active when you are resting or when you are eating or digesting a meal. So you already know what happens. It's pretty much the exact opposite. When you are in a chill mode, your heart rate goes down, the force of contractions goes down, your respiratory rate goes down, you certainly aren't pulling the hair up on your skin, you have more color, you have more blood flowing toward the surface of your body, and there are a few other things that we'll talk about as well in a moment, but we've all experienced that sort of chill moment as well. I always think about going camping, right? You're out camping, the stars are out, it's a beautiful night, you've just had a meal, you're just sitting around relaxing. You're definitely in a parasympathetic mode, right? Your heart rate's down, you're relaxed, you're breathing, it's all nice and relaxed. You crawl into your tent, and 10 minutes after you get in the tent, you're all content. All of a sudden you hear a twig snap behind the tent. And all of a sudden you're worried that a bear or some other animal has come into the campground. And immediately, right? Immediately your heart rate goes up, your respiration goes up, your eyes are going to go bug-eyed, you're going to get, the hair standing up on your skin. All of those things that we talked about are going to go into that fight or flight response. So we've all experienced it. You'll hear me talk about, the bear in the campground sort of thing as an analogy. Oh, and don't forget too, we start sweating, don't we? We start sweating when we're scared. And tell me what happens to your saliva. Right? When you are scared, you go cottonmouth, don't you? You go really, really dry. So these are all the experiences that we all have when we're scared. Okay, so let's continue through this conversation. Don't forget to read this text, but let's talk about the divisions of the autonomic nervous system. And I've already marked a few key things here. So what I'm going to say now is basically a repeat of what I've just said. Nothing wrong with that. Let's hear it again and again and again until we get it. So we're going to talk about, let's back up. Most of what we've been discussing in this course up until now related to the nervous system has been related to the somatic nervous system. The somatic nervous system, the nervous system of your soma, of your body, right? This is, quote, your regular nervous system. But what we haven't yet talked about is the autonomic nervous system, and that's our topic today. The somatic nervous system controls contraction of skeletal muscles, right? Skeletal muscles. Recall that skeletal muscles are voluntary. So your somatic nervous system is the components of your nervous system that you have conscious control over. You say, I'm going to bend my leg, I'm going to move my arm, I'm going to chew my food, I'm going to move my eyes, right? All of those things are part of your somatic nervous system. The autonomic nervous system is going to control those things over which you do not have control. So you know what that means. That means that the autonomic nervous system is going to control your cardiac muscle, it's going to control your heartbeat, and it's going to control your smooth muscle. Remember, smooth muscle is also called visceral muscle. You have smooth muscle lining your blood vessels. You have smooth muscle lining your intestines and your bronchial tree. You have smooth muscle lining your bladder. And finally, the autonomic nervous system is going to control glandular secretions. Think salivary glands, right? You don't have any control over if and when you're going to make spit, right? Your saliva is something that is controlled involuntarily. Same thing is true with your stomach and your liver and your pancreas and all of those glandular organs that are contributing to digestion and hormone release. All of that, my friends, is part of this autonomic nervous system. So again, we're going to be comparing the sympathetic with the parasympathetic. The sympathetic, better known as the fight or flight response. The parasympathetic, oftentimes referred to as the rest and digest division. These two systems, hear me clearly, these two systems are never completely on or completely off. Sympathetic and parasympathetic is not like flipping a switch, right, where one is on and the other one is off. Instead, think of these two divisions like a rheostat, like a dial knob. So you dial up the heart rate, you dial down the heart rate. You dial up the respiratory rate, you dial down the respiratory rate. You dial up your sweat production, you dial down your sweat production. You increase your blood pressure, you decrease your blood pressure. So don't think of these two divisions as on or off, but instead simply a rotary dial where one is being cranked up higher than the other, depending upon the needs of the body. So let's take a look at this first diagram. This is figure 15.2. And it very simply helps us understand what's going on. So let's go through the sympathetic first. Everything I've already said is just listed here, and I've got a couple extra things to add. So what we see in the sympathetic fight or flight response, your pupils are going to dilate, right? They're going to open up. Your pupil is going to be larger. Number two, you're going to go cottonmouth. You're going to inhibit the flow of saliva. Number three, your heart rate is going to go up, and although it doesn't say it here, also the force of your heart contractions will be greater. Not only will you breathe faster, but also your bronchial tree, the airways through and down into the lungs will actually dilate, allowing more air, right, to travel down into the lungs. So far everything over here we've talked about. Here's one that we haven't talked about yet, and that is in the fight or flight response, the activity of your stomach and of the intestines is going to decrease. When you're being chased by the bear, when you're scared, the body's focus is not on digestive functions, right? We have other things we need to take care of. We need to get more oxygen. We need to pump more blood. We need to be able to see things more clearly. So in the sympathetic nervous system, you're going to inhibit peristalsis. Peristalsis is the rhythmic contraction of your stomach and intestines. You're also going to decrease gastric secretions overall. So digestion just simply is not a priority during sympathetic moments. Another thing that's going to happen, the liver. Now, we haven't talked about the liver yet, but the liver does amazing things. One of which is that your liver is always storing extra energy. And it takes the glucose that you eat in your diet and it stores that in your liver as a long molecule called glycogen. And glycogen is broken down to glucose when you're scared. So in a sympathetic surge, the glycogen is going to be converted to glucose. Glucose is going to act as a primary energy source for your muscles and for your body functions. And recall, somewhere along the way, I've mentioned, and if I haven't, I need to now, that the brain only receives glucose as its energy. So all the other food things that you eat, your muscles can use and your other body systems can use, but your brain requires a constant supply of glucose. So when you're scared, sympathetic, the liver is producing more glucose. Another thing is, you've heard of an adrenaline rush. Your adrenal glands, these are glands sitting on the top of your kidneys. The adrenal glands make adrenaline. That's where it gets its name, right? Adrenals, adrenaline. And adrenaline is exactly the same molecule as epinephrine. You've probably heard of both, right? You have an adrenaline rush, or you've heard of people who carry around an EpiPen. So if they have a life-threatening allergic response to peanuts or shellfish or eggs or whatever is their bee stings, whatever their trigger is, we give them an EpiPen. We give them an injection of epinephrine. It's the same as adrenaline, and we'll see more about that in a few minutes. And then finally, when you are in sympathetic mode, your bladder contractions are inhibited. So most of these, right, are things we talked about, things we've experienced. A couple of them, like the conversion of glycogen to glucose, may be new for you. So that's everything on the right side of the diagram. Let's take a look at the left side of the diagram. This is what's going on during rest and digest, during parasympathetic. It's essentially the opposite. The pupil is going to constrict, right? You're going to get very tiny pinpoint pupils when you're more relaxed. You are going to stimulate the flow of saliva. Remember, this is called the rest and digest. So your body and your salivary glands are now going to be making more saliva for the purpose of digestion. Your saliva contains in it enzymes for digestion. Your heart rate is going to slow down. Your force of contraction is going to reduce. Your breathing is going to become more relaxed, and those bronchi, those airways, are all going to now constrict, get a little bit tighter. We don't need as much oxygen when we're relaxed. But here's interesting. Stomach activity, digestive activity goes up. So you actually start to stimulate the secretions of the digestive organs, and you start to increase the amount of rhythmic contractions, the peristalsis of the stomach and the intestines. The liver has a different role here in parasympathetic. The liver, and we'll talk about this later, but the liver produces bile. Bile is a substance which helps to digest fats. So when you're resting, right, rest and digest, when you're eating, you need the ability to digest fats. And so your liver releases bile. That bile is, oh, by the way, stored in the gallbladder and then released. And then finally, related to the bladder, parasympathetic causes contraction of the bladder. So you're going to likely have more urination flow and kidney function during parasympathetic. The one that this picture does not mention the hair on your surface of your body going up, but we'll see that in other diagrams in a moment. So that's a pretty quick and easy way of sort of dividing up and seeing visually the sympathetic versus the parasympathetic. Okay, so let's continue our conversation and take a few minutes to look specifically at the sympathetic division. Again, much of what I'm going to say here and what is written out here has already been mentioned by me, but again, let's hear it again. So again, the sympathetic division is all about a response to a threat, right? You're either going to fight or you're going to run. And one of the things that we talk about when it refers to the sympathetic division is that it causes divergent effects. In other words, there are many different effector organs that are activated for a common purpose. Okay, all that means is this, is that we need more oxygen, right? So you need your lungs to respond. You need more blood pumped through the body. You need the muscles to be activated together. You need all of these things to happen. So one of the things about the sympathetic side of this is that when it is turned on, everything turns on at the same time. So when that bear snaps that twig behind your tent, everything happens simultaneously, right? You go dry mouth, you go white as a sheet, your hair stands up, you start breathing faster, your heart beats faster, your eyes go buggy. All of those things are going to happen at the same time. Another way of describing the sympathetic division is to call it the thoracolumbar system. Now, this is more of an anatomical classification, and you'll see why in a moment. Well, in fact, let's jump down to that right now. In fact, I'm going to jump up. I'm going to go back to the diagram we've already seen and point out that this fact is included in this diagram, although it wasn't yet appropriate for me to mention it. If you look here, everything on the sympathetic side, all of the nerves traveling from the spinal cord and are controlling the sympathetic side, are coming from the thoracic and the lumbar region. So they're coming essentially from the center of the spinal cord. Okay? And what we'll see in a moment is that those things which are controlling the parasympathetic are coming from a pair of places. They're coming from the cranial region, the cranial nerves, and down at the sacral region. So we'll see that in a moment, but right now, this sympathetic division is also called the thoracolumbar division or thoracolumbar system. And like I said, the neuron is coming off from the lateral horn of the spinal cord, and is coming off the thoracolumbar region. The other thing is that the neuron, when it comes off the spinal cord, first goes to a ganglion. Okay, so let's take a look at that also. I'm going to jump up here and look at this as well. Right here, these are the ganglia. Remember, a ganglion is a cluster of cell bodies. So here we see a series of these clusters, if you will. These are the ganglia. Now we'll name a few of these in a minute, but these ganglia are the sympathetic chain ganglia. The other name for the sympathetic chain ganglia, I'll come down here back to where that was. So these are the sympathetic chain ganglia, and the other term for that is that these are paravertebral. Paravertebral ganglia. And the reason they're called that is, you know that para means next to. So these ganglia are next to the vertebra, paravertebral ganglia. There's usually about 23 of these ganglia, all in a chain, in a row, right? That's why they're called the chain, sympathetic chain ganglia. So let's take a look. Here is a little bit more detailed diagram image that's depicting the sympathetic side of things. And a couple things to point out. Number one, again, all the nerves coming off from the spinal cord are coming off between the thoracic and the lumbar region, thoracolumbar. What are these nerves doing, right? Well, we've already talked about this. We've got nerves that go to the eye, and they're going to cause the dilation of the pupil. Sympathetic signals are going to tell the salivary glands to decrease their production of saliva. You're going to go dry mouth. Think when you're public speaking, right? You're scared, and you kind of go dry mouth when you're scared. We have signals that are heading to the heart, telling it to beat faster and harder. We have signals going to the lungs, telling it to beat faster, right, for the lungs to expand more quickly and to open up those airways. We're going to have signals that travel to the digestive system, but remember, what is happening here, that the stomach and the intestines are being told to chill, right? Do not contract as much. So it reduces the contraction of the stomach and the intestines. Remember, it does increase the breakdown of glycogen to glucose in the liver. And then finally, signals from the sympathetic nervous system go to the kidney and tell the kidney to reduce function, and sympathetic goes to the reproductive organs and actually reduces blood flow. So when you are scared, that is not a time where likely erection is possible in the penis or the clitoris. Finally, this image does include the skin. As a reminder, this is going to cause those erector pili muscles to go erect, causing your hair to stand on end. So all of those features are mentioned here, or at least are diagrammed here. There's one more thing, a couple more things I want you to see. Those ganglia, here they are. This is the chain of those paravertebral ganglia. The other thing I want you to see is that there are other ganglia as well, and they have names. Mesenteric, splenic, celiac. Don't worry about these. I'm not going to ask you to name or to label any of these additional ganglia, but just know that they're there. The other thing that is different about the autonomic nervous system than the somatic nervous system is that in the somatic nervous system, there is a single neuron that travels from the spinal cord and travels all the way to the muscle, right, and tells the muscle to contract. However, in the autonomic nervous system, there is a 2-neuron system. Shown here on the bottom, the red represents, quote, the preganglionic neuron. The preganglionic neuron is a neuron that travels from the spinal cord, specifically the lateral horn of the spinal cord, and travels a relatively short distance, travels just to the ganglion. It can be one of these paravertebral ganglion or one of these other ganglia. Then there is a postganglionic neuron drawn in black, which then travels the rest of the distance to the effector, to the organ that is affected. So what we see in the fight or flight response is that there's a relatively short preganglionic and a much longer postganglionic neuron. Now this can be called a neuron. It's really an axon. And remember, another term for an axon is a nerve fiber. So you'll hear about preganglionic neurons or preganglionic fibers and postganglionic fibers. What happens in the ganglion is, remember, the ganglion is a cluster of cell bodies. And at the ganglion, that is where you have synapses. So that's where one neuron speaks to another neuron. So that is sympathetic. Sympathetic. The areas that are in blue, you can cross off. So in this blue area, the text is describing those different ganglia, right? All those different ganglia, and I told you we're not going to worry about those this semester. Likewise, don't worry about this figure 15.4. Jumping here, though, let's just pick up on a couple of facts that are in this chapter, and this is what I just said, that an axon leaves the spinal cord, and that one is the preganglionic fiber, and it is the output from the CNS, from the spinal cord. And then in the ganglion, it's where there's going to be a synapse where two neurons come together, and from there there's a postganglionic fiber, right, the axon from the postganglionic neuron that now goes to the target organ or the target effector. Okay, so we have the pre and the post ganglionic. There is one fiber, however, let's go up and look at it, it's in the diagram. There is one fiber that leaves and does not go to a ganglion and instead travels all the way to the adrenal gland. Remember, the adrenal glands are sitting on the superior border of the kidney, and this is where adrenaline is released. So when your sympathetic nervous system is activated, when you are scared, it actually causes the adrenal glands to release even more adrenaline, right? And you get that adrenaline rush with that fear factor, if you will. And so that is the one set of neurons that travel all the way directly to an organ without stopping in at a ganglion. So you see it's red all the way. And the inside of the adrenal glands, the adrenal medulla or medulla, is where the epinephrine, or again, same thing, the adrenaline is released from the adrenal gland. What's interesting about this, though, and this is sort of where the endocrine system and the nervous system overlap. Typically, hormones are released into the bloodstream. Well, when the adrenal gland releases epinephrine, it also releases that into the bloodstream, which is very similar to a hormone-producing gland. This is also why when you are scared and your heart rate goes up, it takes a little while for your heart rate to return back to normal, because your adrenal gland has dumped adrenaline into the bloodstream, and that adrenaline continues to have effects even after the stimulus has been removed, and your heart rate stays up and your respiration rate stays up for a little while that adrenaline is cleansed from your blood. Again, sweat gland secretion is part of the fight or flight response, and each neuron that sends out a signal for the sympathetic system actually may have 10 to 20 targets. In other words, this is like social media, right? One friend tells their 2 or 3 friends, those 2 or 3 friends tell their friends, and very, very quickly, the whole neighborhood knows what's going on, or the whole school knows. Like I said, when the sympathetic nervous system is activated, all systems are turned on. It's an all points bulletin, right? Every part of all of the responses are going to occur simultaneously and very quickly. So let's think about all of those facts and compare it now with the parasympathetic division. Again, this is that rest and digest division, and it's also referred to as the craniosacral division. I pointed out why that is, but the craniosacral, the nerves that control the parasympathetic system, are coming from a pair of places, P-A-I-R, right? So we have the parasympathetic, right? The parasympathetic is controlled from a pair of places, and that is cranio, right? Cranial nerves, and sacral, right? Sacral nerves. And we'll see that in the diagram in a moment, and I pointed it out on the earlier one as well. Definitely watch the videos. So the parasympathetic is similar in that there's still 2 neurons on the outgoing side. There is still a preganglionic fiber, and there's still a postganglionic fiber. The difference is this: the lengths are going to be changed or flipped. In the parasympathetic, the preganglionic fiber goes all the way, or nearly all the way, to the organ, to the target. And then the postganglionic fiber is much, much shorter. So let me show that to you up here in a diagram. Actually, I'll go down. Let's go down to the parasympathetic diagram. And I want you to kind of pull up the 2 diagrams, put them side by side. Again, we have the neurons involved coming off the cranium, cranial nerves only, and then there are some sacral nerves that also are involved. Notice that the red fiber is very long. The preganglionic fiber is very long. The ganglion is at or near the organ, and the postganglionic fiber is very, very short. You see that in all of these, right? The preganglionic fiber is long. The postganglionic fiber, the black one, is very, very short in all of these situations. The 4 cranial nerves that are sending signals that are part of the parasympathetic nervous system are cranial nerves 3, 7, 9, 10. 3, 7, 9, and 10. Let's figure out what is going on. We already know about these cranial nerves. We already know what they do. Let's just put it together. So recall that cranial nerve number 3 is the oculomotor nerve. The oculomotor nerve is the one that controls 4 of the 6 eye muscles. It controls the up and down movement. It controls the ability to look cross-eyed at your nose. It also constricts your pupil. It's the constriction of the pupil that's the key. So the 3rd nerve, right, comes off the brainstem and travels to the eye, where it is going to cause the constriction of the pupil. 7 and 9. When you hear cranial nerves 7 and 9, facial, number 7, glossopharyngeal, number 9, these 2 nerves are involved in taste, and they're also involved in making spit. So 7, the facial nerve, recall, is the nerve that controls the saliva production from the front two glands, the sublingual and the submandibular glands. It also produces connects to the taste buds involved with rest and digest. 9 is going to carry information for the back salivary glands, the parotid glands, and the back taste buds. So 7 and 9 are primarily about salivary gland responses during parasympathetic surges. And then finally 10. Remember, 10 is the vagus nerve. It's the longest nerve. Recall that vagus means wander, and this nerve wanders down and it checks in with the heart, checks in with the lungs, checks in with the digestive organs. Remember what it's doing, right? It's telling the heart to chill, calm down. It's telling the lungs to breathe slower. But remember, it's telling the digestive organs to increase their function. This is rest and digest. So during this period, you have more blood flow going to the gut organs, and you have more peristalsis and smooth muscle activity happening in the digestive regions. Also, in parasympathetic, coming off the sacral nerves, you also have signals that are going to the anus and to the bottom of the intestines. You have signals going to the kidneys. Remember, your kidney function is actually going to increase during rest and digest. Your bladder function is going to increase. And lastly, when you're relaxed, that's when more blood flow can travel to the reproductive organs to maintain erection in the penis or the clitoris. So again, we see a pair of places: craniosacral, with the pre-ganglionic fibers being long and the post-ganglionic fibers being very, very short. We haven't discussed neurotransmitters much this semester at all. Neurotransmitters are the chemicals released from a neuron. The most common neurotransmitter in your body is one called acetylcholine. It's abbreviated ACH. Acetylcholine is the neurotransmitter that is released onto your muscles and cause your muscles to contract. Okay. There are other neurotransmitters that are also released. In addition to acetylcholine, in the autonomic nervous system, we also have epinephrine and norepinephrine being released. Okay. When the neuron releases acetylcholine, we say that it's a cholinergic neuron. Chol, right? Acetylcholine. When it releases norepinephrine, right? Or adrenaline, we say that it's an adrenergic neuron. Adrenergic, adrenaline, right? And you can see that those words are similar. Now, there's a lot more to this story, but we're going to not discuss it this semester. So again, all the blue areas, skip right over. In this paragraph that I'm circling now, this gives you the history of why we have two names for the same substance. It turns out that epinephrine was the word used in the United States by the researchers who first described this molecule, whereas adrenaline was the word that was coined by the Brits who were studying unknowingly the same molecule. And eventually it became understood that epinephrine and adrenaline were actually the same molecule. And interestingly, we still hear both words, right? We still hear about EpiPens and epinephrine, and we still hear about adrenaline and adrenaline rushes. So they're the equivalent name. Don't worry about the blue areas. Also, do not worry about table 15.1, right? It's blued out. Don't worry about that. And actually, all of this, this blue region, let's not worry about it. Don't worry about figure 15.6. And that brings us to the end of 15.1. Again, the most important thing for you to do is to compare and contrast the anatomy, the functions, the responses of these two divisions. When it comes to the questions at the end of this chapter, you should be able to easily answer 1 through 5, and then you should also be able to answer number 9. Don't forget the labeling activity, and you can also do the vocabulary. So moving on to 15.2, and we're almost done, my friends. Not a lot to discuss in this subsection of chapter 15. So this chapter discusses reflexes, and I want to introduce or just re-emphasize what a reflex is. We've all experienced this as well. So a reflex is a repeatable, involuntary response to a stimulus. Think about what happens when you reach out and accidentally touch a hot stove. Even before you are consciously aware that you have burned your finger, you have already pulled your finger back away from that painful stimulus. About a second goes by before you are even feeling the pain of the blister that's probably forming on your finger. So even before you were consciously aware that you would burn yourself, your muscles had already pulled back. Or think about, for example, stepping, let's say it's summertime like it is now, and you step on a piece of glass. You're barefooted, you step on a piece of glass. Well, even before you are consciously aware of what's happened, you've already lifted your right foot away from the glass, but simultaneously you extended your left leg to catch your weight and to stabilize your body. In that situation, because it crossed over to the other side of the spinal cord, to the other side of the body, we would refer to that as a contralateral reflex, right? Contralateral was introduced in the first lab. It's where things are on the other side, the opposite side of the body. If instead you touched the hot stove with your right hand and pulled your right hand back, because it all happened on the same side of the body, that sort of reflex would be referred to as an ipsilateral reflex. Ipsilateral on the same side. So what is a reflex? Again, it's an automatic response basically meant to protect you from something that could hurt you, and to save time. This is how I think of it. In order to save time, not having to send the signal up the spinal cord to the brain, to your consciousness, and then send the signal back down the spinal cord and out to the muscle, reflexes are actually controlled at the level of the spinal cord. So what does the spinal cord do? The spinal cord not only is the connector between the rest of your body and the brain, but the spinal cord is wholly responsible, completely responsible for your reflex responses. And this is why if a chicken has its head cut off, the chicken can still run around, right? The chicken has lost its brain, but still has a spinal cord. And as a result, for a few moments, right, the chicken might run around because it's just a reflexive sort of activity as the body is still moving, but there's no brain, right? So that's kind of maybe a sad story, but one to help you remember, why does a chicken sometimes run around even after its head's cut off? It's because the spinal cord is still intact and there is still activity there. So don't worry about this long reflex and short reflex, but let's just take a look at this diagram. And here we go. We've got a sensation. That could be let's say it's a thermoreceptor, a burn receptor, a pain receptor on the skin. And that signal is going to travel through a sensory neuron. You know that sensory neurons always travel through that posterior root ganglion, always travel through the posterior root, coming in and synapsing with the motor neuron. The motor neuron is, the cell body for that motor neuron is here in that lateral horn, and then out the anterior horn, out the motor neuron to the muscle, right? So here are the steps. We have a stimulus or a sensation. We have a sensory neuron. We have the integration of that signal in the spinal cord. Notice it did not head up, right? Did not head up to the brain. That would require consciousness. So this is happening at the level of the spinal cord. Then there's a motor neuron that travels out and goes to the muscle. Read through this just for more understanding. And really the last thing that I want you to focus on in this entire chapter is right here, starting with this yellow paragraph. And that is the concept of referred pain. Let me go down to the diagram and describe this to you. I think you already have an idea of an example of this. So if you are having a heart attack, not always, but oftentimes, the symptoms would include a crushing pain in the left pectoral region and pain radiating down the left arm. That's sort of the classic sign that a person might be having a heart attack. Now, this is not true for everyone. Some people will just have indigestion or back pain, but the classic presentation is pectoral pain, left arm pain. What's going on? Well, the heart is what's in trouble, right? The heart is having an attack. A heart attack is a lack of oxygen going to the heart muscle, probably because of a blood clot, right? Or either a blood clot or a building up of plaque that blocks one of those coronary arteries, bringing blood to the heart muscle. So the heart's in trouble, and the heart is sending out signals to its nerve system, and additionally, though, to that, the skin is also sending sensory signals. And it turns out that this region that is in red here, it's the same nerves that the heart is also sending signals from. So basically what referred pain is the brain is confused. The brain is not quite sure, is the SOS signal coming from the heart, or is the pain stimuli coming from the skin? So referred pain, the way I think about it, it really is basically the brain confused about what is actually sending the SOS signal. Another classic example, kidney pain. If you're having kidney pain or kidney infection, or you've got some sort of trauma to the kidneys, oftentimes individuals will complain about pain in the lumbar region that can extend down along the thigh. That is the classic pain area for kidney dysfunction. Okay, certainly a larger area than just the kidneys themselves, which would be sitting right about here and right about here. If you're having liver and gallbladder issues, you may feel that pain actually up on the back, sometimes even high up into the shoulder region. That is certainly not where the liver is located, but you'll feel it sometimes there. Look at this one. This one's really interesting. If you're having issues with your spleen, you can feel that pain basically in your acromial region, right? In your left acromial region. That one's really bizarre, isn't it? But it turns out that the nerve that supplies the skin to your shoulder is the same nerve that supplies the spleen. Okay, thymus, right? Remember, the thymus is sitting on top of the heart up in the mediastinum, and yet the referred pain is quite distant from there. So you get the idea. Appendix, right? The appendix is a very small region of the intestine, and yet it has a rather large area that is painful when a person is having appendicitis. Don't worry about memorizing this table. I'm not going to ask you to label this in any way. Just kind of read through this little bit about referred pain, this paragraph right here above it, and then kind of just check in with this figure 15.8. Now, with this, it's going to be a little bit more difficult for you to answer questions. This blue regions, ignore, and basically everything else as well. Do not read, or you're not responsible for any of this. I did highlight this one sentence or two sentences. I've already said it. That is, the autonomic nervous system is important for maintaining your homeostasis because the two divisions, parasympathetic and sympathetic, are competing. They're working all of the time to balance, right? To balance your organ in your homeostasis. So again, don't think of the sympathetic and the parasympathetic divisions as being on or off, but think of them as dialing up and dialing down. And that dialing up and dialing down is going to increase your heart rate or decrease your heart rate, increase your respiratory rate, decrease your respiratory rate, increase your sweat, decrease your sweat, increase your saliva, decrease your saliva, dilate your pupil, constrict your pupil. So we see that you have this dial of up and down, not on or off. So the rest of this on competing neurotransmitters and all of the rest of this, do not worry about in this chapter. And that means that when you get down to the end, you really have very few questions that you can answer with confidence. So you can definitely answer number 4. Question number 4. You can answer question number 6. And you can answer the vocab questions. So 4, 6, and vocab. And that brings us to the end of this relatively short discussion on the autonomic nervous system. Don't worry about 15.3 or 15.4.